Good morning all. My name is Manu, Chacko, nursing tutor, Faculty of Nursing, Rama University. Today we are going to discuss about first aid management for unconscious patient. At the end of the session you will be able to know definition and causes and signs and symptoms, types and care of unconscious first aid management in unconscious patient. So let's see, what is unconsciousness? Unconsciousness means that the patient is unaware of what is going on around him and is unable to make any powerful movement. The unconscious patient completely dependent on others for all of his needs. In unconsciousness, that means that the patient does not respond. If we are making any loud noise and all, the patient will not respond. And what is the definition of unconsciousness? It is a state in which the patient does not respond to the external stimuli. If we are trying to make any stimuli, he will not respond to the external stimuli. That is the definition of unconsciousness. Next, what all are the causes? What is a cause? CV, that is cerebrovascular accident, head injury and brain tumor and drug overdose and certain infection. These are the certain causes, certain prolonged causes of unconsciousness. So what are the causes? Cerebrovascular accident, head injury, brain tumor, drug overdose and infection. These are the causes of unconsciousness. Next we will see the signs and symptoms. Unconscious patient. So what are the signs and symptoms of unconscious patient? In signs and symptoms, the person will be unresponsive. If we are trying to wake up, then also the patient will not respond and he is unaware of his surroundings. He don't know what is going on around him. He is unaware of his surroundings and then makes no purposeful movements. He will not make any purposeful movements because of his condition and does not respond to questions or to touch. If you are asking anything, then also he will not respond. If you are touching also, he will not respond to anything. And loss of bowel or bladder control. He will completely lost his bowel and bladder control, and abnormal eye movements are absent and abnormal pupil reactions. So these are the signs and symptoms of an unconscious patient. Next we will see the types. What all are the types of unconsciousness? The first one is stupor. What is stupor? It is called as semi-conscious. The person will only respond to loud noise. Stupor. What is meant by stupor? It is called as semi-conscious. If we are making any loud noise, he will respond to the loud noise. And fainting, it is a temporary loss of consciousness. Fainting, that is a temporary loss of consciousness. He will recover within 2-3 minutes. He will recover from that. So fainting, that is a temporary loss of consciousness, temporary losing the consciousness. And somnolence coma, it is a state of feel sleepy or drowsy, and it is a complete loss of consciousness. And if you make any painful stimuli and person is not respond and pupil not respond to the light. And so what is somnolence coma? It is a state of feel sleepy or drowsy, and if you are making if it is loss of consciousness, if we are trying to make any painful stimuli, if you are pricking also, then also he will not respond. If you are making any loud noise, then also the patient will not respond. And eye movements are absent. If we are full stimuli, then also the person will not respond, and pupil does not respond to the light. If you are trying to switching on the torch and watching, then also the pupil reaction will not there. Eye movements are absent. So these are the types of unconsciousness. So what are the types? Stupor, fainting and somnolence coma. What is meant by stupor? It is called as semi-conscious, and the person respond to loud noise. If you are making any loud noise, the person can respond sometime. And fainting, it is a temporary loss of consciousness. Patient will recover from within a few minutes. It is a temporary loss of consciousness. And somnolence coma, it is a state of feel sleepy or drowsy, and it is a loss of consciousness. And if we making any stimuli, the person not respond. If we are making any purposefully, if we are making any painful stimuli, the person will not respond to the stimuli, and people not respond to the lights in somnolence coma. So these are the types of unconsciousness. Next we will see the care of the patients. What all are the care of the patient we need to give? So first, airway and breathing. So what all are the care we have to give in the airway and breathing? So maintain a patent airway by proper positioning of the patient. That is important to give a proper position. So maintain a patent airway by proper positioning of the patient. So whenever possible, position the patient on his side with chin extended. Whenever possible, have to position the patient on his side with the chin extended, and the position on alternate side every 2 hours to prevent secretion. So secretion can come. So position on alternate side every 2 to 4 hours to prevent the secretion accumulating. So the lateral recumbent position, that is the safest position. The lateral recumbent position is often referred to as the coma position. It is referred to as the coma position. And suction the mouth. Always suction the mouth. If secretion is coming, you have to suction the mouth and administer oxygen as needed. If oxygen is needed, you have to administer the oxygen, and chest percussion and postural drainage may be prescribed to assist the removal of tenacious secretions. Chest percussion and postural drainage may be prescribed. It is prescribed, may be prescribed to assist in the removal of thick secretions for tenacious secretion. So these are the airway and breathing. So what are the care we have to give for the airway and breathing? So maintain a patent airway. That is important. Maintain a patent airway by proper positioning of the patient, and whenever possible, position the patient on his side with the chin extended, and position on alternate side every 2 hours to prescribed 2 hours to prevent secretions accumulating. And the safest position, the lateral recumbent position, is often referred as the coma position. And suction the mouth, suction the trachea and pharynx and all, and administer oxygen as needed, and chest percussion and postural drainage may be prescribed if to assist in the removal of the tenacious secretions. And these are about the care of airway and breathing. And next, what are the nutritional needs? Input output chart should be meticulously maintained. That is important to maintain the input and output chart should be maintained, and daily weight should be taken. So, you have to take the weight of the particular victim daily, and it is important for an unconscious patient, gastric gavage. So, for the unconscious patient, feed is given through the gastric gavage, when the medication are given through the gastric gavage, and diuretics is prescribed if there is any edema and all. So, according to the condition, diuretics doctor will prescribe, and fluids are maintained by the IV therapy. So, we have to maintain the fluids and through the intravenous therapy. These are the nutritional needs. Input output chart should be meticulously maintained, and daily weight should be taken, and diuretics is prescribed if it is necessary according to the condition, and fluids are maintained by the intravenous therapy. So, these are the nutritional care, nutritional needs for an unconscious patient. Next, we will see the skin care. So, what are the skin care we have to give for an unconscious patient? The unconscious patient should be given a complete bath every day. So, it is important to give the bath daily. The unconscious patient should be given a complete bath every day, including things in the perineal area and all, clean daily. So, it is important care. The unconscious patient should be given a complete bath every day, and the skin care skin should be lubricated with a moisturizing lotion after bathing, and nails should be short. So, the skin should be lubricated with by using the moisturizing lotion after bathing, and nails should be shortened. Otherwise, the patient itself can cause injury to himself by the movements. The skin should be lubricated with moisturizing lotion after bathing, and nails should be shortened. Otherwise, it can cause injuries themselves. And provide oral hygiene at least twice per shift, and when giving mouth care, apply petrolactum to the lips. Provide oral hygiene at least twice per shift daily. at least 2 times. We have to provide oral hygiene at least twice per shift, and when giving mouth care, apply petrolactam to the lips to prevent drying, and keep the nostril free of crusted secretions, and keep the nostrils are free of any crusted secretions in the nose. So give care for that. Keep the nostril free from any kind of crusted secretions, and check the eyes for the signs of infection and irritation. And frequently you have to check the eyes for any kind of infection or irritation if he was having in his eyes. So frequently we have to check his eyes, and comfort device should be used, and proper beds and all. So comfort device should be beds to provide give to the patient, and cornea should be kept moist by instilling methyl cellulose 0.5% to 1%. So cornea should be kept moist. Cornea should be kept moist by installation of methyl cellulose 0.5% to 1%. So these are the skin care to provide to an unconscious patient. So unconscious patient should be given a complete bath every day, including his perineal area and all, and the skin should be lubricated with moisturizing lotion after bathing. Nail should be short to prevent any injuries, and provide oral hygiene at least twice per shift. When giving mouth care, apply petrolactam jelly, and keep the nostrils free from any kind of crusted secretion, and frequently we have to check his eyes for any kind of irritation and infection in his eyes, and comfort device should be used, proper bedding and all, and cornea should be kept moist by the installation of methyl cellulose 0.5 to 1%. These are the about the skin care. And next, the elimination. So what are the things we have to, the bowel should be evacuated regularly to prevent infection. So it is important to, the bowel should be evacuated regularly to prevent infection, and you have to note down the bowel movements and all, the particular time, consistency. You have to note down the movement of the bowel, the time, color, and we have to note down the bowel, about the bowel movement. And if enema is ordered, use proper technique. So if we are administering giving enema, so we have to use the proper technique for administering enema. And the bladder should be emptied regularly, and bladder should be emptied regularly. We have to note down the time, consistency and all in that, and provide catheter care. If so, we have to it is important to give the catheter care also. These are the eliminatory care. So these are the, what are the skin care? In skin care, we have to see the patient, unconscious patient should be given a complete bath every day, and the skin should be lubricated with moisturizing lotion after bathing, and nails should be shortened, and provide oral hygiene at least twice per shift. When giving mouth care, apply petrolactam jelly, and keep the nostril free from any kind of crusted secretions, and check the eyes for any kind of infection and irritation, and comfort device should be used. Cornea should be kept moist by instilling methyl cellulose 0.5 to 1%. And next, elimination. In elimination, the bowel should be evacuated regularly to prevent from infection, and if enema is ordered, use proper technique, and the bladder should be emptied at regular interval. So bladder should be emptied regularly. So we have to see the time, consistency and all, and the time of evacuation, and provide catheter care. Next we will see the positioning. So what are the care we have to check while giving a position? So it is important when positioning the patient, pay particular attention to maintain the body alignment. So while giving a particular position, it is given, so we have to pay particular attention to maintain proper body alignment, and limbs must be in a supported in a position of function. So while changing the position, it is important, limbs must be supported in a position of function, and precaution must be taken to prevent any development of pressure sores. So precaution must be taken. So you have to take necessary precaution. So pressure sore can come. So we have to take necessary precautions to prevent the development of pressure sores, and protect the patient from injury. Keep the side rails up. So it is the chance of the patient can fall downwards. So fall down. So protect the patient from any injuries and so keep the side rails always up and use restraints according to that doctor's instruction. Use mitten restraints to restrict the movement of, maybe he can to catch that if catheter is there, he can pull the catheter and also we have to take necessary precautions for that. Also use restraints according to the doctor's order. Use mitten restraint. And this is about the positioning. So what about positioning? What are the care we have to see for the positioning? When positioning, the patient pay particular attention while changing the position to maintain a proper body alignment, and limbs must be always supported in a position of function, and precaution must be taken to prevent any development of pressure sores, and protect the patient from injury. Protect the patient from injury by keeping the side rails up, and use restraints according to the physicians, according to the doctor's order. So it will protect from pulling the catheter, so the patient can pull the catheter, and also use restraints to prevent movements. And sensory stimulation. Next is sensory stimulation. The brain needs sensory input. So I have to widely believe that hearing is the last sense to go, and so talk and explain to the patient what is going on. Always while giving any kind of care, we have to talk to the patient what is going on around him. So widely believe that hearing is the last sense to go. So talk and explain whatever we are doing, whatever kind of care while we are giving to the patient, talk and explain about it. And encourage stimulation by massage, combing, washing hair, playing music and bringing perfumed flowers and all. So encourage stimulation. So how can we encourage? Encourage stimulation by giving massage, combing and washing his or her hair, and playing music and bringing the perfumed flowers and all. And encourage a family to contribute the care of the loved one, and encourage the family members, to the particular client's family members, to contribute to the care of their loved ones and provide privacy for them. So encourage family to contribute the care of their loved ones and provide privacy. And these are about the sensory stimulation. What are the care we have to give? Widely believe that hearing is the last sense to go. So it is important while caring, while giving any kind of care to the patient, talk, explain to the patient what is going on, what we are going to do and what is going around him. We have to talk and explain to the client, and encourage stimulation by massage, combing, washing hair and playing music and bringing perfumed flowers and all, and encourage a family to contribute to the care of the loved one. So far we discussed about the first aid management for unconscious patient, definition, causes, signs and symptoms, types, care of the patient, first aid management for unconscious patient. So I hope you all understood the topic. Thank you.